Another layer of care for both patients and families at community medical centers are child life specialists. We sat down with one to find out what role they play. Thank you so much, Hannah, for joining us.
Thanks for having me.
Now, you have a role here at the hospital that many may not be familiar with. It's a child life specialist. What does that mean?
Child life specialists are healthcare providers who are part of the psychosocial care team. So we are dedicated to supporting the psychosocial needs and the developmental needs of children and their families who are experiencing potentially stressful healthcare experiences.
What are some of the patients that you focus on?
So we work with everyone from newborns up to teenagers, even young adults, depending on the need. But children who are the most at risk for struggling with a hospitalization or having developmental regression after hospitalization tend to be 6 months old to 6 years old. That's kind of our target age group.
And so what are some of the things that you do with them?
So one day it might look like preparing a child before they're going to have a surgery by explaining to them in words that they can understand what everything is going to be like, what they're going to experience, so that we eliminate some of that fear and give them a sense of control through knowing what to expect. Other days it might be helping a child to add bandages to a doll that mimic the bandages that she has to help normalize an experience that might otherwise be stressful or scary for her. So we use therapeutic play and child development theory to inform the ways that we help children to cope with whatever it is that they're going through that might be stressful for them.
What would you say the overall value of your job brings to the hospital setting?
I think that for children, we're really helping to reduce how traumatized they can be. We're helping to limit the chance that they go home from a hospital having regressed behaviors or behavioral difficulties with adjusting to getting back home. For families, we're reducing a lot of the stress and helplessness that they feel by empowering them with ways that they can be effective in helping their own children cope. So we work with parents on strategies for how to help get your child through their hospital stay. And I like to think we bring value to staff as well by helping to limit the need for a lot of extra staff in a room to get a procedure done, by helping the child, the parent, and the staff member all feel calmer about what we're going through.
And also important to note that this service is free for the patient and their families, and that's actually pretty unique for community to have a child life specialist on board.
The more that we learn about medicine, the more that we learn about child development, is that the body and the mind aren't two separate things, that how a patient feels emotionally, how they're coping psychologically has an impact on their healing and on their health overall. And so to be able to address the whole child and not just their injury or their illness, and to really treat the family as a whole unit and not just a case that's coming in is really crucial to health outcomes.
Taking treatment that one step further that really is going to be making a difference, for sure. Hannah, thank you so much for your time.